Hello, everybody. This is Tim Mitchell with Pharmacy Frontiers Podcast. Welcome you to another episode. We've got some really interesting things to talk about today, about a very unique pharmacy and a couple of people that are always thinking outside the box, doing some really cool stuff in pharmacy and really doing a great job taking care of people. We've got Henry Irvin and Heather Burney, who has been on our podcast a few times, I guess. One for the Bowl of Hygeia, and then we had you on with the pharmacy students. Was there another one? Is it just those two?
I think so far.
So this is you're a three-timer. So yeah. Hey, wow, we haven't had a three-timer. So
I'm waiting for my jacket because you gave out.
Oh yeah, that's right. I still owe you a T-shirt too.
Well,
so
I'm like, if I'm a three-timer, like an SNL when they give you a jacket.
Oh, good point. Good point. Yeah. Yeah. And Henry, we do have our Pharmacy Frontiers podcast shirts that I'll have to get you. Did I get you one, Heather? I can't remember if I got you one.
I got one.
Okay, cool. We got one at the MPA conference. And we ran out of them there, so I'm going to have some more made. I've got to hit Ron up for some money to get some more T-shirts. So anyhow, I'm excited to have you guys on here. I think there's a lot to learn. I think there'll be a lot of people who'll be interested to know kind of what you guys do and go from there. But for those of the people that don't know you guys, many people probably know both of you, but let's just kind of, because this podcast is actually starting to get out there all over the nation. Actually, I've had people from not just Missouri telling me they're listening to it, which is kind of cool. So, and non-pharmacists as well. There's people listening to it. Although this podcast is designed for pharmacists and pharmacy technicians, our goal is to get information out there for people to understand what's going on in the profession of pharmacy and especially in the state of Missouri and how innovative the pharmacists in our state are. So I do want to segue just a second and say the opinions on this podcast are our own, not the opinions of MPA. Although this is a podcast supported by MPA, we try to follow some good practices here. We may say things that MPA is not necessarily endorsing or whatever. So just wanted to make that clear. And you can listen and share these podcasts with your friends. You can listen on, I think she's got us on just about every platform now. I think Spotify and YouTube, and I don't even know what all the ones that are out there. Apple Podcasts or something. I don't know. So listen on your Podbean. That's another one. Listen on your favorite one that you want to listen to, and hopefully it'll be something that you continue to listen to. So for those of the individuals that are listening right now, I'd like for each of you to kind of introduce yourselves, kind of tell a little bit about your history. Even though you're a three-timer, Heather, I'm going to let you start and tell a little bit about your history, what you do now, and then we'll just kind of roll from there, and then we'll get into Henry. So, Heather.
Awesome. So I'm Heather Burney. I am a clinical associate professor with the UMKC School of Pharmacy at the Missouri State campus. So I'm located in Springfield, Missouri. As a clinical faculty member, I have a practice site within a primary care clinic. And so interestingly, that's not how I started my career. I started my career following residency at Cox, worked in a neonatal unit and high-risk OB, became really interested in the longevity of getting to know those patients as well, and the creative solutions that we had to come up with to take care of babies that didn't have medication that was made for them, commercially available. And so that was wonderful. Also very team-based. So my entire career, I've really worked alongside other healthcare professionals. And then that evolved into my husband and I had one community pharmacy. I left Cox to open the second one. We ended up with a third pharmacy. Within one of those, we had a compounding pharmacy as well. I became very involved with hospice and palliative care as well. And and then ended up selling those pharmacies at the same time that I was a part of opening a nonprofit charitable clinic. So I opened a clinic to serve the primary care needs in our community that I really saw because I was a pharmacist, because I was a community pharmacist, and people came to us for triage a lot of times and to ask the local pharmacists their opinions. And so really recognized that, and early on recognized the need for access to medication, that although you can prescribe something all day long and you can diagnose to your heart's content, and it may be the most wonderful diagnosis and you're so spot on, if the patient doesn't get the medicine or take the medicine, you've done nothing. And so we really recognized that early on. And then I became a faculty member at UMKC and went into more ambulatory care within a clinical practice. And then in early 2023, was able to open my neighbor's charitable pharmacy, and was able to swipe Henry from his previous position in about 2022 to help kind of launch my neighbor's charitable pharmacy.
Oh, that's amazing. And you know, when I look back in your history, I've known you for a while, and seeing how your career has evolved over the years, it's amazing, and it's no doubt to how successful you are just by based upon, you know, your history and how you love to take care of people. And I think that's amazing. So Henry, she segued into you, so it's up to you now, buddy. You've got the next 25 minutes to talk about yourself. No, I'm just joking.
Oh. Yeah, I won't take that long to talk about me. No, I was born and raised Southern Illinois, hometown pharmacist. We were really great friends, and they had gone to Still Cops, so that was kind of where I went. Worked full time during that time. Was married, had a kid in school, which is kind of crazy, and just stayed with Walgreens as a pharmacist when I got out of school. And that, you know, is kind of history of what I've done. I did that for nearly 20 years. And then in 2022, I believe was the year, I left Walgreens, and through mutual connections, just kind of found Faith Community Health. I'd known Heather for a long time because, you know, when Heather said she sold her pharmacy back in 2008, it was to Walgreens. And so we had met back then and got to know each other. And I'd known what they were doing at Faith Community Health and the work that they'd done, and was very curious about this new pharmacy idea, this charitable pharmacy idea. And so I got with Heather, and she grabbed me up right away and got in with that. And she'd already done a lot of the legwork with the Board of Pharmacy and statutes and laws. And I'll let her talk a little bit about that too. Because that was important. I mean, she's being kind of modest on what she's done in the beginning parts. I helped write all the policies and procedures, and just helped with the grant writing and with the fundraising to be able to get this off the ground. And finally, 2023, we opened the first charitable pharmacy in the state, my neighbor's charitable pharmacy. And so that's kind of my history. I've been here as the executive director and the pharmacist in charge for the last 18 months now, and just seeing a lot of growth, a lot of wonderful patients that are coming in need. I know you're sending this out to pharmacists and technicians, and that's the main demographic for this podcast. And let me tell you, when you have 95% of the people that come in on a daily basis grateful that you're here and happy, and it really just heals your soul from the 20 years of community pharmacy that I was in before.
Yeah, and you know, I would assume that since it's charitable pharmacy, it's probably modest copays or low copays of whatever. I mean, you have to be able to bring some sort of funds in to be able to help pay for the place, but I think it's amazing that, you know, people can have access to medications. So tell me, Heather, where'd you get the idea? I know it kind of said Henry said you guys kind of started this prior to him coming, but kind of called him and was, I guess, kind of pulling him along, and then he came in and helped. So where did you was there other individuals, was there physicians and nurses involved in this decision to go ahead and try to do a pharmacy? And then what kind of model did you have to try to support it? I mean, I know Henry mentioned some grants. I know you guys had to figure out how are we going to budget this, and how are we going to, it's a real life business, even though it's charitable, and I assume it's nonprofit. But tell me a little bit about how you guys started with that.
Yeah, so it's topsy-turvy. It's a completely different pharmacy environment. So when we have students in, it's really different. I mean, it looks like a pharmacy. I'm always like, it looks like a pharmacy. It smells like a pharmacy. But when you get behind the counter, you're like, oh, wait, this is a little bit different.
What does a pharmacy smell like? I want to know.
Depends on what bottle you have open. Like metformin. Bleh,
yeah. Ooh, it better not smell like
spironolactone out.
Yeah, get some spironolactone. Yeah, it'll be good. So, yeah.
Sorry, I just thought that was something funny.
Yeah.
So it's different. All right.
So it's totally different. And so, like I said, with the clinic, with the charitable clinic, we started with a medication office. And there are organizations that work specifically with charitable clinics and charitable pharmacies. And one of the big ones that we hooked up with when we opened the clinic in 2010 was Dispensary of Hope. And they're based out of Nashville, and I'm pretty sure almost in every state in the country now. And they work directly with manufacturers to get medications donated. So this is medication coming directly from the manufacturer. And so that's one organization that we work with. There's several others organizations that we work with. And so we piecemeal together basically a pretty robust formulary. And so out of our clinic's medication office, it was pretty robust, but it was physician dispensing. And so again, we were pharmacists within the clinic, but we couldn't practice pharmacy. So we were there to advise medications. We could teach patients about the medications. We would see patients in the rooms and manage and monitor them, but we couldn't be a part of the dispensing process because that was the provider's role. And so the other piece being that we would get calls from our local hospital, from others in the community, other providers, and they would ask, okay, so I have a patient and they're being discharged, or I have this patient and they can't afford their inhaler, their insulin, their heart medication, their anticoag, name the drug, and they're not taking it. And so can you help them? And we would say, well, are they a patient of the clinic? If no, then no, we can't. Right. And so that's really where it kind of spurred off. We had been involved with the National Association of Free and Charitable Clinics and knew that they had a branch of charitable pharmacies. So it's Charitable Pharmacies of America. Knew about that, really started investigating what was happening in other states and how they were managing it. And again, it's fairly state specific. It's based on the needs in that state. We all know that every state does things a little bit differently. And so, we took that information, we looked at what we needed in our community, again, went to the Board of Pharmacy, who was incredibly supportive and really helped to foster this legislation to get through. And then we were able to have the Class Q charitable pharmacy designation and launch this crazy beast of a pharmacy. And again, it's pretty unusual. We could get in the weeds, but we're here.
No, you gave me the 30,000-foot view, and that sounds great. I think that's amazing. So we'll let Henry tell us all the daily duties that's going on now. So she said that it looks like a pharmacy, and I guess it smells like a pharmacy. But what goes on behind the scenes may be a little bit different. Henry, tell me a little bit. I mean, Heather just alluded to some of the things. Tell me what you do on a daily basis. I mean, you have a physician that sees a patient, having some needs on some medications, can't afford it or whatever. I assume tell me how, do they pick up the phone and call you and say, or do they walk over to the pharmacy and say, I need you to help me. This person's on this real expensive drug and we need to find something that's like it. Tell me what you do.
Really, Tim, all of the above. We receive referrals from doctors. We receive referrals from pharmacies. As Heather mentioned, the kind of behind the scenes where it doesn't look the same is we don't charge anything for the medicines that we
Don't
do.
charge anything at all.
No.
Wow.
And so because of the really generous partnerships that we have with Dispensary of Hope, another one is Direct Relief, AmeriCares, with our local health systems, we're able to get medications free for the most part. And so we're able to take that and turn it around and give it back free out into the community.
That's
So
amazing.
yeah, that's why it really doesn't look or on the other side of the counter, it doesn't look like a pharmacy. So what we do is, because of our relationships with Dispensary of Hope, Direct Relief, we see patients who are uninsured or underinsured and fall below 3 times the federal poverty limit. So right now, a single person can make over $45,000 a year, family of 4, over $93,000 a year household income, and they still qualify as long as they're
Wow.
uninsured,
That's
underinsured.
cool.
Right.
Yeah.
And so it's really generous. You know, we really look to serve the community of people who are kind of in that gap where they don't really qualify for federal or state help, but they can't afford the marketplace insurance, and their job doesn't offer insurance, and so we're really that rural kind of safety net pharmacy. So help me out, Heather, where we're going.
Yeah, and I'll just add, one of the things that we started off with was the intention to become that patient's pharmacy, their hometown pharmacy, the way that it should be. We want it to be like Cheers. When you walk in the door, like Chris Gerritsen had said, last time, we want them to
Hey.
yes, it's and so that's what we want. And that's what happens. And so we have Henry, who's worked in community pharmacy. We have 2 technicians that have done the same for many, many years. And so they really get it and they understand those relationships. And so beyond just providing access to medication, it really is about what the pharmacist's role is in there. So Henry providing that education and helping the patient understand the importance of it, medication adherence, medication synchronization. We're doing everything that a normal pharmacy would do. Immunizations, point of care lab testing, recently got some grant funding to do colorectal cancer screenings and helping patients with that. So, quite a bit of things that on the outside looks like, wow, this is a robust community pharmacy. Our revenue generating piece is a lot different, but we at the end of the day want to be the community pharmacy for those patients.
Well, I will say, unfortunately, traditional community pharmacies have turned out we might be better off if we all filed nonprofit status these days because of the way insurance companies work.
It's kind of crazy, though. I don't know if you want to do it.
You what?
It's a little crazy. I don't know if you want to.
Oh, I'm sure it is. I was a joke.
I'll tell you what, Tim.
Yeah.
It is easier. Honestly, I tell people it's easier for me to get medication for patients without insurance than it was for me to ever get medicine for patients with insurance.
Right.
And, the partnerships that we have are great. We do patient assistance programs here, which a lot of pharmacies don't ever touch, right? So we do, we get in contact with the brand name manufacturers to get medication shipped either directly to us for the patient to pick up or shipped directly to their house, which is a free thing for them. And a lot of the companies have really kind of stepped up, and we say the drug companies are the bad guys and they're multi-billion, trillion-dollar companies. But I mean, our relationship with Eli Lilly allows us to have free insulin for patients, free Trulicity. Novo Nordisk has been wonderful with allowing us to order Ozempic. We've got Invokana, Xarelto. I mean, some medicines directly in the pharmacy where we don't have to do those patient assistance programs. But when we do have to step up and do that paperwork, we're able to work that out with the doctor and with the patient to get it for free for them as well.
That's cool. So do you guys employ community health workers at all? Or, I mean, that's been a buzzword here recently. And I would assume somewhere in your clinic, you've probably got community health workers. But it'd be nice if you have them in the pharmacy as well.
So we had a community health worker that was specifically designated as such. Right. He unfortunately left us. He
Or so
wanted to
you
go
said
to pharmacy
had, so that
school.
didn't sound too
Yeah.
good.
He wanted to go to pharmacy school, and I can't stand
Good
in
for
the
him.
way of
Yeah.
that. Uh, I will say the two technicians that we have are certified technicians, and between the
Yeah.
two of them have over 40 years of experience in the
Sure.
world of pharmacy. So they are community health workers. They just don't have that certification behind
Yeah.
them.
No, that's cool. Well,
We-
we all know how important pharmacy technicians are,
Yeah.
and I think licensing or registering them or getting them certified as community health workers. Really, talked to Trip Logan about various things, and he said, of course, you're not dealing with a lot of payers, but he said when he goes to payers and he says, my pharmacy technicians can do this, help us do this. They're like, well, that's pharmacy technicians are supposed to do that. When we say we have community health workers and they're the same people, it's like the discussion turns and they're like, wow, we have community health workers too. And I get it. We see it. We're seeing it with CPSN as well. So now I just want to talk about you a little bit here. We're kind of getting close to being done. Henry, you just won an award at Missouri Pharmacy Association. What was that? The most innovative pharmacist award or something like that?
Pharmacist making a difference.
Pharmacist making a difference. Wow, what an amazing name for an award! I would love to have that given to me. That is amazing, and the things that you're doing for your community has made a huge difference. And Heather, you probably need to get one of those as well. Have you ever gotten that one?
I don't know that I might have gotten that one in the past. I can't remember. Yeah. I think I don't remember, but yeah, it's so wonderful. So very, very proud of Henry for that. And truly, like you've mentioned, he's really nose to the grindstone, opening up this pharmacy. It is a different model. So he mentioned grants, and so it's a nonprofit. So we're a 501c3 nonprofit organization, which you have to be to be a Class Q charitable pharmacy in the state of Missouri. And so it is really funded majority by grants and donors. And so that's a whole nother beast to have to manage.
I'm sure you got to have fundraisers and all kinds of things to kind of help support your cause. So now if pharmacy students are interested in doing rotations, you have a rotation there, you say?
I have a rotation specifically in the pharmacy. It was interesting to speak with the UMKC and Still Cop. I'm going to call it Still Cop regardless of what it is, but to see what kind of designation our rotation was going to be, because there's never been a Class Q pharmacy before. And so, we are in there as a community pharmacy rotation. But the experience is a lot like ambulatory care. I mean, with the point of care testing and all of the educational pieces and the recent colorectal cancer screenings and all of the education we provide, it really looks more like an ambulatory care rotation. And so students will get a unique experience if and when they come here.
Absolutely. Well, and Heather, I don't know if you wanted to say anything. I know you're on kind of on both sides of that rotation. You can facilitate on the charitable pharmacy side, but you can also facilitate from the school side because you have students there. So I don't know if you wanted to add anything to that.
Yeah, absolutely. So it's a great opportunity. We've always had students that have, maybe a public health interest as well, and learning about this from a public health perspective. Everybody's a bit fascinated with grants and how those work. And so getting some insight into that on this rotation, I think is a really great experience too. And to Henry's point earlier, our patients are really happy and grateful and thankful. And so, that is very heartwarming for them. And in, like you'd mentioned, in this world where there are few and far between, great pharmacies like Mitchell's Drug and the Melody Savely's of the world and the Chris Gerritsons of the world and the Chris Tadros and like all of those folks that are doing these great things. There's few of them. And so having students see a working charitable pharmacy that works in the auspices of a hometown community pharmacy, I think is really great. And to let them know that it can be done. And this is new. And so you can still be innovative in 2024. You still can.
So we're going to kind of wind it down, but I'd like to ask you guys a couple things, or actually one thing, but each of you will go. I'd like for Henry, if you don't mind, tell all of our listeners something about you that not too many people may know about you. Something interesting, maybe a hobby or something. I don't know. Just throw it out there. What do you think?
So I actually met my wife in pharmacy school.
Okay.
And
She's a pharmacist.
no, in fact,
Oh.
so this is the story. So I met my wife in
I'll shut
pharmacy
up.
school. She dropped out of pharmacy school and went to Barnes Jewish Hospital College of Nursing at the time.
Oh, okay.
We had kids and she kind of stayed at home.
Gotcha.
We live at Table Rock Lakes, so we love to go out and be with our kids, and it just ended up working out that way for us. But now my wife is a plumber. So
wow, that is very, very interesting. I didn't expect that to go there at all. And you know what? Plumbers do very well. I had one to come out to my house the other day, and my goodness, they do well.
So I met my wife in pharmacy school, and she's a plumber, of course,
cool.
right? So that's something interesting, I think.
Very interesting. Well, I thought she was a pharmacist. That just threw me totally off. So, well, that's very interesting. Heather, you want to throw us something interesting about you, your family? You kind of already told us your history. So.
I know. I feel like I'm a bit of an open book most of the time. For most people, I do think sometimes it's surprising for some people to realize how much I like getting my hands dirty. So I am not afraid of a power tool, and Henry can attest to this because we've done some. I'm not afraid to get in there and
you like to demo stuff and knock walls down and stuff,
or build it back up. I have every power tool you could ever imagine. My dad secretly supplies them to me. And so, yeah. And Brian Burney doesn't know where any of them are. And I kind of hide them. That's on purpose. That's on purpose.
You tell him to leave your power tools alone and you'll leave his golf clubs alone, right?
Exactly. Yeah.
I'll tell you.
It's a good relationship.
It is a scary time when you see Heather walking through the door with a drill in her hand.
It's like, going to go work on something. Well, guys, I appreciate you being on today. It's been fun. It's been always interesting to hear new, avenues in the profession and the different things that people are doing. And Henry, your class act, I appreciate, all the things you're doing. Your award's very well deserved. I'm glad you are in the position you are to take care of people. And, I just appreciate you telling your story. Heather, always a joy having you on, and always enjoy chatting with you and learn more about what you're doing. I learned something about you I didn't know, and I've known you for probably 20 years now. So that being said, we're going to sign off. Just remember to, like and share this podcast. And Pharmacy Frontiers is a podcast supported by MPA and the pharmacists of the state of Missouri. We want everybody to listen and learn more about great things that are going on in the profession of pharmacy. We appreciate everyone for listening, and make sure you share it with your friends, and we'll just keep letting everybody know about what's going on. So thanks again, guys. Appreciate your time.